us doctors or allied professional, you have to go to most of us will go to PubMed, right? Right. You are all have done your masters, right? Anybody who has not done masters here? Okay, not to worry. So it's like an eye opening for you. Okay, so you got to do first. You got to have database to search. Okay, so what you search, the most popular search is PubMed. Okay, if you are a clinician, surgeons, any specialty, in all the other side of medical fraternity, meanings it can be ophthalmologist, it can be orthosurgeon or general surgeon, internal medicine specialist. All of you will definitely need to look at the PubMed first. Second, you must know a bit, if not much, a little bit at least, Cochrane Library. So who has not yet served Cochrane Library? Go through the web of Cochrane Library. Okay, so everybody has by and large passed through that Cochrane Library. Okay, Cochrane Library is a database. We in NIH we subscribe that Cochrane Library. So you got to thank the National Institute of Health, because Cochrane Library is available for everybody in the country, as long as the IP address is Malaysia. Anywhere in the country, you can get the full text. So you got to make use of that. So a lot of thanks to National Institute of Health, because they spend a lot of money for the Cochrane Library. Okay, so if let's say you have a critical care question, you have a clinical question, clinical answer, plain language summary, you can go to Cochrane Library. Cochrane Library is a systematic review of intervention. So if you have a clinical question, you go to the Cochrane Library. You can Google Cochrane Library, and then you either can register. If you don't want to register, also it's okay. If you want to find out anything about intervention, because Cochrane is an intervention review, you can find all the answer. We call it a clinical care answer. Okay, so you can start Google and try to download as many as you want. It's freely available for you. So you must also know, everybody heard, right, of Cochrane Library? You also heard of Cochrane Systematic Review, right? Everybody knows, right? Okay, I am one of the trainer for Cochrane Systematic Review writing. So you can come over to us if you want to do a Cochrane review. Up till next month, it's still easy for you to apply for Cochrane Systematic Review. Okay, so it's Cochrane Systematic Review is a review of intervention. You also have other type of systematic review. So as I said just now, primarily you search original articles. Second, you search systematic review. Okay, so you must know how to critically appraise this both. You don't need to know much about guideline or case report or case series and all that. You must know only primary research, that means original article, and of course systematic review. So next. So what is critical appraisal? So critical appraisal is a method for you to examine the quality of the study that has been conducted and published in all the peer review journal. Most journal nowadays, they are peer review. Hardly any journals that is not peer review. So why you need to look at all the journal, and you have to know whether the evidence that has been published, whether is a good quality or not. You look at the journal, you have to find out whether it has been done scientifically sound, if the research has been published, you want to know whether it is very sound, of methodically sound or not. If not, the result that has been published is not valid for you to use. There are a lot of studies. I know, because while you are doing your masters, you of course will look at a lot of studies, right? So you can't just simply. I have got a lot of students also, internal medicine, especially pediatrics. Pediatrician, they, I don't know why. Maybe they look at me, then they feel uh, very kesian. To me, I also don't know. So a lot of them come to me. They will say, "Okay, I want to do this kind of study. I want to follow this." You can't do that. You can't just because it's been published. You say it's has merit. It's not like that. Okay. There are a lot of journals like high impact, especially natures. Under natures, you got a lot of subjournals. A BMJ is quite difficult to challenge, and then plus under plus you could have plus one and all that. So uh, well, while you are doing masters, you will say, "I want to do exactly like this." You can't do like that. You have to come. Your your idea have to be very very sound, manageable. I mean, it can be conducted, not to say easily, soundly, meaning that you don't miss anything scientifically. For example, when you collect the data, you find out that there are a lot of patients, and most of the patient doesn't have the data that you require, even though you do prospectively. That means you collect, you face to face with the patient, but sometimes what the patient has and what you want are totally two different things. So when you want to conduct a research, you got to be very, very particular about the methods. Most of the time, the methods is very, very important, because if the method is wrong, then anything else cannot be used. Okay? So, why another thing why you want to do a critical appraisal? Because you want to use the result. For example, you have studies on ivermectin, the most popular situation last time, right? A few months back, everybody said, "Why cannot use ivermectin? Why cannot use ivermectin for COVID?" Right? You all know about that, right? So uh, we said you cannot use ivermectin. It's not effective. Why? Because there are so many studies in it where the authors actually doesn't recruit, like did not recruit the patient, uh, you know, correctly. Okay, and when they measure the effects of the intervention, it will have a different meaning. Okay, so if you look at the paper, there are a lot of papers on ivermectin. I remember it was 5 papers on ivermectin say that it's good, but there are another 7, if I'm, yeah. Yes. So what I want to say is not effective. However, that 5 studies that has been conducted among all the few countries, they say it's effective. But you don't know how effective it is unless you know how to criticize. You not to criticize. You have to look and do an appraisal for the studies that has been published. Okay, so that's why you need to know how to appraise, so that you don't just simply give the intervention, that means ivermectin, to all the patients. Okay, so next. Okay, this one, when you are looking into the papers, first of all, when you want to appraise, this is the simple method I want to tell you. First, you look at the title, okay? When you look at the title, you see whether you can understand the title or not, okay? Second, you got to see the abstract. Easy, right? You were taught this before, right? So you have to look at the abstract. Under the abstract, you look at the abstract usually have introduction, isn't it? Introduction, objective, then method, result, and conclusion. In abstract, you always have these five. Okay? You have introduction, objective, methods, result, and conclusion only. So even, let's say if you are writing an abstract to submit to conference, you want to submit to any seminar, you must have these five because they will request from you the abstract, right? So must remember this five. So when you want to appraise an article, you have to look at this abstract first. Then you look at, the most importantly, you look at the methods, okay? So from the method, you will know automatically whether what type of study design that has been used. Okay, how many types of study design that you know? Hello, friends. You are quiet. I know you are tired, but you know the study design, right? Right? How many are there? Study design. Correct. Okay, I give you easier method to remember. Okay, study design. I cannot say you are moderate level. You high level already, right? You are somebody high already. Not medical student, not master student. So by right, if you don't know, I can. Right, I have to quick you a bit, but no, I won't do that. Okay, so study design is divided into two. One is observational, one is experimental. Okay? Under observational, just remember, okay, this one you have to remember, especially if you are clinicians, okay? Under observational, you have cross-sectional, cohort, and case control. It's easy, right? Under experimental, you have the highest level of evidence among the primary study, RCTs, randomized control trial. You have clinical trials, you have cluster trial, you also have quasi-randomized control trial. That's all. You just remember this, you are safe already. So all this study design, you must know how to identify. Can you tell me how to identify this study design? Okay, under observational. We go one by one. You are now criticizing a paper, you know, you are doing the appraisal now. I am not going to lecture. I'm going you to tell me, want you to tell me so that you remember. So under observational, you have how many just now? Yes, cohort, case control, cross-sectional. You also have one more, then they say survivor. That means time to event. Okay, time to event. Usually we use it in cancer studies, in death or alive and all that kind of time to event studies, which is usually we call it a cohort. Okay. So what you must know in cohort, what is uh, what is uh, what is the content of cohort study? What make it a cohort? Kawan, huh? Somebody said something? Yes, clever. So any cohort, when you read an article, you see if in the article, in the method section, they say we follow the patient from baseline and to 6 months, or we follow for a year, we follow for 2 years and all that. There is no doubt a cohort. Okay? sometimes the authors, they are very tricky. They pun want to see whether the readers are clever or not. They don't tell. They don't tell that in the methods that it's a cohort study. So how do you know that it's a cohort? When they didn't say there is a follow-up. How do you know it's a cohort? You look at the statistic. Okay? So when in the statistic, you have like group 1 at 0 month, they give you table, kan? Right? So the table is for 0 month. And then second table for 6 months. And third table in 12 months. So you know already it's a cohort. So that is how you critique, okay? And then, okay, we go to case control. What make you say it's a case control? Because you have case and that you have control. You have disease and non-disease. Okay, you have one patient with rheumatoid arthritis and another one group without rheumatoid arthritis. You have a group of diabetes and you have a group of non-diabetes. They may have other disease, but not the disease that is in the question. Okay, so once you have that, you know that what is case control? Case control is disease and non-disease. Case or control, you know already is case control. Sorry. Another thing for you to remember, if it's a case if it is a case control, what is other things that you will know? It's if it is a case control. You look at the statistic also. The statistic will say odds ratio. This much odds of having the disease is this much odds. So if the statistic sections mention odds ratio, then it's a case control. But sometimes authors also, they are blur. They also write for cohort, also odds ratio, cannot. For cohort, you use risk ratio, RR, relative risk or risk ratio. Okay? Hello? So you follow, right? So when you want to critique a paper, you want to appraise, first look at the title, second look at the abstract, and then you have to look at a bit in the introductions. The introduction should reflect the title. Okay? Let's say, for example, I give you example, ivermectin for I say effectiveness of ivermectin for COVID-19. Okay, so in the abstract, in the introduction, you have got to have a background. So in the background, you have to look into what it say. First, it has to have any information, not all information, but in a brief information on ivermectin as a drug. What is it used for? How does it work? So you must have that in the introduction. Second, if you are doing intervention studies, that means because ivermectin for COVID-19, to treat COVID-19, you must have some ideas to write that ivermectin is like more or less will do this to COVID-19. Okay? It no need to be you no need to write it in land, but you can cite other paper. So in the introduction, it has to be a bit. It has to be quite brief, and it has to reflect the titles. That is how you critique, you appraise a paper. If it doesn't have that, then you say no go. Okay. Then after that, you look at the methods. Forget it. First, before the method, you must look at the objective. Whether in the paper, if are there any objective in the papers or not. So if you look at the article, they didn't mention the objective, you also will go haywire because the title say this, but in the content doesn't have anything about the objective. So when you don't have objective, how do you do any analysis? You can't do any analysis because the analysis should be it should tally with your objective. Okay, so actually this is how you critique anything, even original articles or systematic review or scoping review. So you have to look first the title, second the abstract. The abstract, I said you have to have that five. I just show you the uh, slide, but I'm not using this slide. Okay, I just use it as a guidance so that if you need, you can take from us. Second, second, the abstract, and then third, the introduction. Look at the introduction. Does the introduction, you look at it, does it cover does it reflect the titles? Then you look at whether there is any objective. Objective usually one or two, like if when you always read an article, it will say like at the end of the introduction, background, they say, therefore or hence, we conducted this study to determine, to identify, to evaluate. That phrases you must remember. Okay, that sentence at the end of the introduction, meaning to evaluate, to describe, to determine, to identify, must be there because that is the objective, not yet the outcome measures. Okay, then you go to the methods. In the method section, it's compulsory. It's compulsory for you to mention about where the study is conducted, who is the participants, what is the intervention or the test that you are going to show the readers, and then you must also show also what is the outcome. That is in the method. So you need to know where to put, where is the study conducted, who is the participants, where and when. You must remember that. When you cannot lah study conducted when I was 17 years old, baru you nak publish. Cannot. That means it has to be latest study, meaning the last 2 years, plus minus 2 years. Okay. Then you have to tell the study design. It's for me, I do not want to burden my readers, so I will tell my readers straight. This is a cross-sectional study. Case control study was conducted like that. Okay? And then in the method, you got to say how many you invited to participate in your study. Okay? So let's say they said you recruit 100 or 200. Okay, class, if you recruit 200, what is the meaning of recruitment? And what is the meaning of how many participant is included in the study? Class, I want to know, what do you mean by recruitment? Recruitment means how many you invite to join your study. You are surgeons. How many surgeons are here? Surgeon, they all surgeon garang-garang. How many physician, internal physicians, trauma? Semua orang tak nak ngaku dah. Semua orang tak nak ngaku. Dia trauma, what physician or trauma surgeon, whatever. Tak nak ngaku Okay, tak apa. I forgive you all. So, you are surgeons, you are also trauma specialists. There definitely, trauma mean accidental kan? If not suka-suka hati. Of course somebody come with the attempted suicide. There somebody come like jumping from the Klang River, which I don't think anything will happen to them if they ever jump into the Klang River. Klang River, is it very deep? No, right? Like you cannot even sunk perahu kecil kan? Let alone Titanic, isn't it? Not so deep, right? Shallow only kan. So those who are cycling suddenly they want nak lomba dengan I want to compete with a lorry or I want to compete with a Lamborghini. Semua tu purposely lah kan cari pasal. So what I'm trying to tell you, when the patient come to you, you don't know how many unless those with appointment, right or wrong. But trauma got appointment, is it? They just come and goes, right? They want, right? Nobody's business, isn't it? Like surgeon, you have make appointment, right? Unless it's emergency surgery, isn't it? So from there, you can differentiate already. How many appointment, how many emergency surgery. So those who come to you, like they all come with like very terrible pain. Do you think you want to ask, you want to join my study or not? You want to join or not? You go ask like that, is it? Sorry? Yes. So they are like that. You don't ask. Like when they okay, smiling at you, then you can ask, would you like to join the study? So that is called invitation, recruitment. Then patient asks, if I join your study, what I get? Do I get to cut the queue? I come only, I see you immediately so that I don't need to wait. Something like that, right? Then you say, no, cannot. Then I don't want. Patient say like that. Isn't it? Right. Most of the time, patient can be very difficult to manage, but of the, let's say, 100 patients in a week, you get in a week, I doubt you get 100, definitely more. So let's say in a week you get 100, then you will invite the 100, and then of that 100, you say, because they look at you, they feel very pity for you, you look very tired, and you got to finish a lot of work. Okay, doctor, I agree to participate. Kan? Ada kan macam tu patient yang baik hati kan? Ke tak ada? Tak ada ke? Ada kan? You got right that kind of patient who like so nice. Forever trying to please the doctor. They got sick also, they say, no, I'm not sick. Right? Okay. So of that, you must remember, let's say it's 100 patients, then agreed to participate is 85 or 86 or 87% out of 100. What do you call that? 86 out of 100 patients who agreed to participate. You only senyap lah. You untuk fikir pasal patient ni. Okay, 86 out of 100 is 86% response rate. So the response rate is very, very important to put in your study if your study is observational. Okay, meaning you are going to observe the patients, so you must remember to put the response rate in the study, in the article. So when you read an article, it's observational, but they didn't mention the response rate, -1 point for them, for the article. So you must remember that. However, for the experimental studies where you recruit patients, like one of your colleagues say just now, on RCTs. So for RCTs, you do not have a response rate. You look at the missing data. Okay, missing data means you have got, for example, 100 patients, but during the analysis in the statistic, you say the analysis was conducted only for 87 patients. So where are another 13 patients? It's missed, right? The missing, it can be missed, not all. You have like maybe socio-demographic, you have all 100, but when you do further analysis, is n, the big N becomes small n. So n, the big N, the small n will be 87. So you know there is a missing data, missing values. So in the analysis, you got to, in the article you appraise, you have to see if they explain the discrepancies in the numbers. Follow? If they don't, if let's say they explain, they say actually we recruited 100, however of the 100, 13 refused to join the study maybe at 6 months, 13 refuse to join studies at 3 months, and then they give reason why these people do not join the study. You say that is a very good write-up. If they hide, that means they have got intention to hide actually the result, so minus 1 point. So that's why you need to look at the detail in methods. Understand? I am not going to go going to go into detail. I can see your face, oh macam penat sangat. So I will go I touch base on it, okay? If you need further, you are always welcome to see me. If you cannot come and see me, you can online with me. You can definitely have a video session with me. We always have video session, right, Dr. Hasna? You can always, or maybe you start, you cannot write, you can always come to us, give us a copy, and then we will vet through that. Because you all at one point or the other must write something, isn't it? Can? Especially those who are doing masters, finish masters, becoming a registrar, whatever, I don't know what stage you are, you've got to write a report, isn't it? So we are in evidence base, we encourage you to come to us. So finish about the methods. Okay, so that's all you have to read. You have to see the number in the method and the result, whether they tally. If they not tally, minus 1 point. You have to question where does this 13 person go? Dia tak boleh naik to kayangan there and there kan? Isn't it? So what else you will critique? Apart from what I said just now. Major only. I give you major. So we can finish before 4:30. Before 4:30 we can finish. Apart from that, what else? Tak nak lah. Result. Clever. She's very clever. You have to give her. Oh, we forgot to bring biscuit. Alah. Okay. Result section, you got to see what type of test they do. Statistical test. All of you are okay with statistic? Medical statistic, I mean, not that JPJ statistic, not that Malaysia census, the biomedical statistic, medical statistic. Are you you jangan malu-malu. Just now when I went to CRC Putrajaya the last 3 days, I said, how many of you, but they are small number, but they are doctors. How many of you know about basic and basic and moderate, statistic, not advanced? They say, can you teach us basic? So I can understand if you don't know, don't be shy, because it took me 7 years to know if the write-up is like this, the statistic is like that. I say, oh, it's wrong. It took me 7 years. Like you do master 4 years, I do master also 4 years. Lepas tu I went for attachment, that 1 year attachment, I still cannot understand. Then do it again and again. When I was doing the attachment, then my lecturer look at me macam, you are lost in space. You are definitely not fit for this. Definitely not fit for this subject because I ask you A, you answer Z. He told me that on my face also. So I macam, oh, I and the downers of the downers, like I got to go dig my own grave like this because I don't know A or Z or whatever at that time. So if you don't know, not to worry. You can come to us also. You still can come to us. That's why I said we are here to help you. So statistic means medical statistic. Anybody know what is chi-square? You jangan cakap tak tahu. Ni I marah. How many of you don't know chi-square? What is chi-square? Hello class, I'm your friend only. I'm not going to eat you. Huh? Chi-square, chi-square. Don't know? Yes, no, yes or no or blah blah, a clear, a crystal clear. blur. Everyone. Okay, no problem. I also like that. It's better mengaku, okay? Chi-square, you must remember, is like univariable analysis, meaning univariable analysis mean you have got one variable and you want to see the association with your outcome. Use dependent variable, independent variable. You know what is dependent and independent variable, class? No, actually not class, my friends. You know, right? I tak dengar. Banyak tapi macam tak dengar. You know what is dependent variable? Okay, never mind, I tell you. Dependent variable means it's the outcome you measure. Ivermectin for COVID. That means what is it? Effectiveness, efficacy, and safety. So you have the outcome. The outcome is one is effect, one is safety. So that is the what? That is the dependent variable. The independent variable such as patient's age, gender, any comorbids, and how many days of getting COVID, all that, right? How many times getting COVID, that is all independent variable. So when you want to see you get COVID, and at the same time, the intervention is you get the ivermectin, and you want to see this ivermectin. How come this ivermectin? Some can say work, some say not working, some say not working at all, some say it's very effective. So you want to see the effectiveness, you have to see the independent variable. Betul tak tu yang very clever tadi dua orang tadi? Very, very clever. Kan? So you must know, you have to see all these factors, whether it associate or not with the case. That means COVID-19. Okay, so this one, when you want to test, what do you do? Chi-square lah, tadi baru cakap. Kan, baru cakap tadi. So remember, chi-square is a univariable analysis. What you do, you want to find association between independent and dependent variable. Okay, this one is basic statistic. Okay, lepas ni I nak pergi kat moderate statistic. So sekarang you know chi-square already. Now I ask you t-test. You know t-test? Have you all heard t-test? Okay, what does t-test do? Huh? Yes. What they see, what they test. Yes. Huh? Okay. Okay. So who said compare means? You two sangat-sangat clever because you like numbers. So t-test, remember t-test. T is to compare. So remember when you go out, oh tadi kan I cakap Dr. Nur Asiah tadi I pergi kelas dia, senang je nak ingat. T to compare. So t-test is to compare until you retire, okay? So in the study, in the article where you appraise, you have to see whether they mention or not that they have conducted this. Okay? When do you conduct t-test? When you have continuous data. Continuous data means the outcome must be continuous. Meaning like you cannot say got COVID or not COVID. You want to see the percentage of certain let's say you do a PCR test, you want to see the multiplication. Is it increase or decrease like that? So you say you compare with A and B. Like what your colleague just now said. Your clever colleague, you got to say yes because he likes numbers. Other people don't like numbers, I think. How many of you like numbers? Okay, so you must see in the way you appraise an article class, you appraise an article, you got to see if they do the univariable. How do you do that? You look at the explanation. Usually univariable analysis will not be in the table. They don't include univariable analysis in an article. That because if you include that, something is wrong somewhere if they publish that. So usually you don't put that. So you got to read between the lines. So they will say in the method section or in the statistical analysis, because you have introduction, then you have objective, then you have methods. In the methods, after the methods, you got to say, you have to write all about ethical consideration. So you have to see in the article they have or not ethics, whether they obtain an ethics or not, ethics approval from their following the Helsinki uh, what is it? Guideline, the Helsinki guideline. You have to ask for ethical approval. Okay, so you got to look at all that. Okay, then you see whether they mention or not. If the univariable analysis is being done, they will usually say in like in one or two two sentences actually, that we have conducted a primary analysis to identify the factors that associated or that can be compared with the whatever outcome, and then we found out this. Then we further do this analysis. So in the method section, you have to see that. Okay, so after that, the result section, you look at the result, whether the test is appropriate or not. So how to know whether the test is appropriate? I told you just now, right? T is to compare, chi-square is to find the association. The extended version for this is multiple logistic regression and linear regression, or ANOVA or ANCOVA. I'm not going to go into detail into that because habis dah masa. Oh, lamanya so you got to know all that. And then you go into the discussion. Discussion, you can see whether the result is appropriate or not. You can say when the result is like this, you look at the article, then the article will say, this one is, our study found this, but actually in other studies say this. So there are comparison between the result in that study with the result in other studies. Okay? And then you have to have strength and limitation. You can see whether the study have got strength or limitation. If they don't have, minus 1 point. Okay? And I think that's all. Any question? Oh, penat dah. I said dah 4:30 ke? Oh, okay. That's why you lambat penat. Any question? Okay. So thank you very much for listening. I will go to scoping review. You want to listen to scoping review a bit or not? Okay, maybe Hasnah can teach a bit of introduction to scoping review. We go very touch basic. Just now I touch basic only with you because it's 45 minutes only. So this one is for the 45 minutes or half an hour kan. You nak balik cepat.
Okay, Assalamualaikum, salam sejahtera. Assalamualaikum, selamat pagi, selamat petang. Ada orang ke ni? Masih lagi okay ke? Are you okay? Okay, doktor, you okay? Okay, so sementara nak tunggu the slide is on. Do you have pernah baca any reviews paper? Pernah baca tak? Tak dengar lah, pernah baca ke reviews paper? Pernah. Pernah buat tak review paper? Tak. Ada rasa ingin nak buat tak? Ada rasa tak? Tak ingin? Salah kelas ni. Okay, ada rasa ingin nak buat tak review paper? Rasa nak buat. So, ada cikgu ke? Pernah pergi mana-mana workshop pasal review tak? Pernah pergi mana-mana workshop pasal review? Pernah tak? Tak pernah. Yang pernah? Never go, but like to say, never go and you comprise it to 45 minutes. So it's very hard for us to teach because like Datuk said, it takes about 2 days. Biasanya. Yes, minimum 2 days. 2 days pun we have to teach faster. Very fast. Okay. Okay, so belum lagi. Okay, so for you know that there are many reviews available online. So you have scoping. What else? What else? Okay, kalau buat thesis you have literature review, right? And if the boss ask you to do something, you can say rapid reviews. So you have to do it within 1 day. Oh my God. 1 day do the review. Then we have systematic review, meta-analysis, and others. So for today, will introduce about the scoping review. So this is very basic lah, scoping review. Okay, next. Okay, so what is the main point you have to think when doing the scoping review? First, of course, the research objective, the research question. Why? Why you are going to do the scoping review? Is it for fun? Is it for fun? Is it for fun? No, okay. So is it for KPI? Okay, yes. So we are doing this for the KPI. Okay, of course. So actually it's for you to know about something. Okay, for example, during the COVID time, which vaccine is better to treat the COVID-19, to prevent the COVID-19, for example, right? So that's the first thing you have to know, the research questions and also objectives. Okay, next. So this is the steps. So this is kalau you guys go for the online, maybe different, but this is what we are doing. We are basically do. Okay, next. Okay. So for the first step is identifying the research question. So there is a formula for the scoping, which is PCC. So means that you have to remember lah until you tired if you interest to do. Okay? If you're not interested to do, you have to remember as well. Boleh? Boleh? Boleh. Okay. So P is for population, C is for content, and C is for context. So is it need to have every PCC in the scoping? No. The most important thing you have to do P and 1C. Okay? Tak semestinya semua, dua pun dah cukup. Okay? So P, you can say adult, children, what is your focus group? Okay? So macam emergency, you want to know why the kid like to main mercun, for example lah. So of course, your population is the kids. So mungkin you guys, mungkin doctors divide the children into the ages. Yang muda, mungkin atau yang umur 16 ke atas, for example. Okay? So next, C. So it's a content, for example, intervention or the outcomes, you can say. And then context, for example, you can say the culture, the gender, as well as geographical, for example. Okay, so let's, next slide. Okay, let's do some exercise. Okay, so for example, how researchers use of social media, a scoping review. So can anyone guess which is a P, the population? The population first. Apa then? Okay, dah boleh buat scope dah. Okay, tekan. Okay, so the health researchers and the content is the use of the social media. Okay, okay next. Okay, kita tambah skip for the context, so which is Malaysia. Okay? Okay, tekan je. Okay, next one, another title. Okay, for this one, okay, can anyone tell me which is the P, the population? Betul? Okay, betul. So adult, okay, which is the content? Content dia panjang sikit. That's a clue. Okay, press. Okay, so again solution on the mechanical properties. And next, the context is the rural dentistry. So that's how you do the first steps, which is your PCC. Okay? Okay, next. The second step, okay, so then know the research question, know the objective. Next step, of course, to look for the journals. So there are a few available journals. Okay, I told you the free one lah. Okay, everyone love the free items, right? Okay, so the free one is the PubMed. Everyone know PubMed, right? Warna apa dia punya dia punya depan tu interface? Okay, betul, warna biru. And another one I can say Cochrane lah for sure. So dia warna ungu. Okay, so for the M-Bands and others berbayar. Okay, berbayar. Okay. Okay.
Researchers, if they are rich, they give you for free. So, what Dr. Hasna is mentioning is actually the database, the journal where the journal is parked. So you have to go through. It's not it. You do not need all to go through all, but it's a compulsory for you to have 3 databases. So which is 3? PubMed, Cochrane, and it like because you are doctors, right? So I will say, you go to clinicaltrial.gov, which is free. The rest all you buat.
Okay.
We are teaching you something.
Next. Okay. So basically dengar ke tadi? Can you hear? Okay, basically what the minimum databases is 3. Okay, minimum. So kalau orang kata is it Scholar Google Scholar can we include that? Itu soalan paling famous. So kalau boleh please avoid lah. Please avoid. Yes.
The articles that are there is a search engine. It's not a database. So you type anything in Google, it pop out. Then you still have got to take it to the database, which is PubMed or Cochrane and all that. So if you say, why can't we do Google Scholar? You cannot use Google Scholar if you are academician, doctors, and all that. So you go straight to those who give you the data, meaning give you the article. Right? So the article is the data for peer review. So you go direct into the database. You put all that you want. Okay, there are methods of doing that searching. Okay,
Next. Okay, so after you find the suitable database, so the first thing is the keywords. Okay, based on PCC. So this is scoping review, so PCC. So so next. So PCC is a conjunction to combine, or maybe you can exclude the keywords result to be the more focused and productive results. So it saves time and eliminate the improperty hits. Okay, next. So when to use or? Okay, senang, I can say it's a synonym. Means that, for example, population. Population is a children. So what is a name for the children? You can say young adults. You can say kids. You can say maybe neonates, babies, toddlers.
you go to PubMed because we have no time now to talk about other database. When you go to PubMed, the interface PubMed come up, then you can look on the left hand side. Down first, just down the PubMed search, you can see advanced search. Advanced, they write the advanced. You go Google later, you search, you click advanced, then you put all the keywords together. One group population you put all. Another group of like context of content you put all, and then another group of geographical part you put all, and then you combine P, C, C, and N.
Okay, that's great. Then the next slide will explain. Okay, next. Okay, and next and okay, you know that our formula is P, C, and C, right? So you combine the P, C by using N. Okay, next. Miss next. Okay, for now is you don't want to include the keywords in the searching. For example, you want to remove. Okay, next. Okay, so you can have your we call this as a balloon together. For example, you want to put the knots and or in one searching. Okay, next. Okay, or maybe you can put or macam like say that or is a synonym. Okay, put all the synonym and then you matchkan with the end for example the formula is PCC, match the P with the content and also the context. Okay, next. Next. Okay. Okay, so next after that, the third step is the study selection. You want to select the articles that you want to review. So there are two steps. First, title and abstract screening. So after that have been done, you go for the full text screening. Okay, so basically this is when the inclusion and exclusion criteria is established by who? By the authors. So this you decide what is the inclusion and also the exclusion criteria, and at least two reviewers per steps. Means that for the title abstract, you have two persons. So for example, the hit about 100. So 100 for the first reviewer and same article review by the second reviewers. Okay, masa tu you include, exclude based on the title abstract. And then kalau ada difference thought, you can appoint one person who is very have the experience in that time in that particular terms that you want to do. Okay. No.
Definitely a big no, capital N and O. Okay, if you want to do scoping any reviews, you need to have a minimum of two person. So the two person will do the work as independently to reduce the bias. Okay, because if you do one, only one of you do, then you will definitely include everything or exclude everything because we don't want to be taken to ourselves. I don't want to be taken to myself. So I will try to remove a lot of us study. So that's why you need two person. And then if that two person cannot come to agreement because like one person say include, this person say exclude, you don't want to have start a World War III, right? Right. Otherwise, then everybody go by pistol, go by like a magic gun or whatever who can like do like that, then everybody die. You don't want to have to do that. So you need to have one referee. So the referee can be your ketua jabatan lah. Ask your ketua jabatan to have the headache lah because he asks you to do everything. So your head of department can be the arbiter. Okay? So
Okay, so for that you can use the online, the free software we call as Ryan software. So the first reviewer, we know how many articles that have been is accept, exclude, and everything. Okay, next. Okay, so you have to have the Prisma flowchart for the reviews, any reviews, scoping, systematic, meta-analysis. So next. Okay, so to help you to arrange the review, of course, pendengar kan EndNote, pendengar EndNotes, Medley. Okay, Medley desktop tak ada ya, kita guna sekarang Medley reference manager which is a little bit hard to drag the reference, so dia ada cara dia, kena convert. Okay, next. Okay, so the next steps for the full text, you have to extract the data. What you want to see, what's the objective, what the outcomes, everything. So there is no standards of the on the of the tables. Basically, what is the standard is the year, author, objective, study designs, and the result is depend to the authors. Okay, next. So this example of the scoping review. For the two. Okay, evidence tables. base table, step by instruction. Okay, next. Okay, so next, after that, you have to tabulate your results to the table, to the figure, anything that is suitable for the readers to read. Okay, next one. Okay, so this is structure. It basically is almost same as the articles that you have been read before. So need to have the abstract. The introduction clearly states about the PCC. And next, the statement of the primary research question. You have to state there. What is the research question? Okay, next, the methods. Obviously, need to say what is the inclusion and exclusion criteria, which is same based on the PCC. The next, of course, the results. Okay, next. So discussion, you have to state the limitation, strength, and conclusions. And also put the reference and also the appendix. So the figure, the flow chart, we put it in at the appendix. Okay, next. So this is what we call how to report the resource. We have the Prisma checklist. Okay, next. Scoping review.
When you put the Prisma checklist, the editorial group, they will look at the Prisma first and they see if the Prisma is correct, then only they will go and back through. If the Prisma is not correct,
They reject. Most of the time they will reject. Okay, next. So you can read the protocol of the scoping review here. We're using the JBI format. Okay, next. So this is the checklist for the scoping review. It's almost same as this systematic and meta-analysis. So you have to fulfill the checklist. So they have about 22, if not mistakes, the checklist. So next. 20 or 17. Okay, next. Okay, 22. Okay, next. Okay, the next. Okay, okay, that's all. This is exercise. So like what Datuk say, it takes about 2 days for the scoping review. So we have to compile, I think I have to present about 20 minutes. So are you still interested to do the scoping review after heard this? Okay.
We encourage you to write a scoping or systematic review. Systematic review is much tedious and tougher, because if you said just now statistic chi-square anti-test was tough, was difficult. Meta-analysis is much more complicated than that, even though the analysis is not so complicated. But scoping review, you must remember to answer clinical question and to identify the gap. Okay, so you do scoping review. You can't just suka-suka hati buat research and waste a lot of money. And when there is already the research question that has been answered is glaring onto your face, and yet you still want to do that topic. Cannot like that. So first you do is you look at the scoping review. You check the scope, and if you think you have a gap in that topic, then you go do primary research. Okay, and sometimes when you do scoping review, you find out there is a gap. Where the gap is actually can be answered through systematic review, then you do systematic review. We go very fast just now, but actually it's not like that. If you want to go further, we have to show you how to search, how to search study, how to import study, and all that. It cannot be done in 45 minutes or even a day. So hopefully, if you are interested, you can come to us anytime. Or even, let's say, your boss, your pengarah, or whoever, your ketua program, the chief of service want to find out about something, and you want to find out fast, you can come to us and we help you how to do it also. Okay, we are here to actually help everyone. That's all. So I hope you enjoyed the talk just now, and I also hope that you are okay and do not get disheartened. And you are always welcome to come to us. Okay. With that, I thank you very much. Hope to see you again. Okay. Thank you.
Thank you so much, Datuk Dr. Nur Asiah, as well as Dr. Hasna. So I think we have time for at least one question. Anyone would like to ask any question to Datuk? Yes, sir. Would, would you like to introduce yourself and from which center? Testing.
Assalamu alaikum. I am Dr. Said Hassan, Egyptian, and I am associate professor in Cyberjaya University of Surgery. I only want to add that all items of research but must be ended by references, recent references about the review, about the discussion, the results, but comparison discussion. I don't say there is a discussion of the result and the review. Review must.
Thank you very much. Any other question? No more. You are in the, yes. So come again. Oh, contact number. Okay. You can contact Hasna. Can you say okay? My email address, because she has to give also. So my email address is Norasiah, 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 dr @gmail.com. Okay. You can also email to Dr. Hasna.
Okay, you want my, okay, I give you office phone number first lah. Okay, easy right? Okay, 03 3362 8491 8491. Okay, 03 3362 8491. So that's direct to me. Okay, if I tak ada, there is one RO, Iza. So I think 3% of there, so don't worry. You cannot. No, because Dato is not always not around. So today is lucky because he's around. Okay. Okay, so email, I give it easy lah. hasnamakmur@gmail.com. Hasna, HASNAHMAAMOR@gmail.com. Makmur. Okay. MOR. MAAMOR. Sebab I punya GOV panjang sikit.
You are welcome to contact us at any time, even if you want personalized training or you want a personalized guidance to write an article, to write a review. You are always welcome. We have got a lot of children. I work with clients because
Client.
I said it. I said students because all of you are much younger than me, so you can come at any time. I am sorry I don't have. I can't give my number. I also cannot remember the number actually. You may go to NIH, call the general line and ask for me. Okay, I think my line 8905. 8905 kan? 87, see? I forgot already. My extension is 8705. 333, all that I don't know. You can look at the NIH. So you can contact me. There will always be a person, one person in my office. Actually, it's not one person. It's for every. many person in my office. So you can contact me if you want to make appointment, or if you want me to help you with a statistic, or if you want me to help with the write up a guideline and all that. You can always contact us. Okay? Any other request or question? That's all. Okay, thank you very much for listening. I hope I don't tire and bore you. Okay?
Thank you so much, Datuk. Datuk Dr. Nur Asiah as well as Dr. Hasna for sharing their breadth of knowledge. I feel that both of them have a lot to share, a lot more to share actually, but because time does not permit, which is quite a dismay actually. So I hope in the future, personally, I hope in the future if there's any future talks or courses, please do share with us because it's a very interesting introduction to the topic as well. Okay. So with that, I would like to call upon Dr. Rosman to present Certificate of Appreciation to both our speakers. Firstly, presenting the certificate to Datuk Dr. Nur Asiah. Next, I would like to call upon Dr. Hasna Makmur for his second talk. Masuk sekali. All right, thank you so much everyone for your kind attention. I hope you all had a fruitful second day, and I hope to see you again tomorrow at 7:30 a.m. for registration as well as breakfast. I've been told by our food committee that it's nasi lemak for the morning, and for lunch it's going to be also a special menu which is nasi hujan panas. Nasi hujan panas. Okay, so hope to see you tomorrow. Have a good rest. And please do not forget to register for day 3 as well. Thank you.